Stopwatch here, that over here. So, my name is Nathan Border. I'm going to be doing this whole physical assessment with my friend here, Justin Jones. So we kind of do this in a formal perspective where we start off, we say, "Hi, Justin, how are you, buddy? Good. You doing good? Do you need, are you comfortable where you're sitting? Yes. Do you need to use the bathroom or anything like that? No. No? Okay, very good. So, is it okay if we go through this whole head to toe series with you? Yes. Wonderful. So I'm gonna wash my hands here, and then we're first just gonna start with our general survey of the patient. So we would look at the patient's appearance. He seems healthy, clean, and no distress. His behavior is calm. His body structure is intact and erect, and his mobility is good. I saw him walking through the room, so that was all good. Next, I'll go ahead and just check your level of consciousness questions here real quick. So can you tell me your name and your birthday?
Justin Jones, 10/19/72.
All right. And then where are we right now, Justin?
We are in your home in Henderson, Colorado.
Yep. Apologies, I don't have access to a clinic room right now, so we're doing this on my own. Can you tell me what year it is?
2024.
All right. Who's the president?
Joe Biden.
Okay, so the patient is alert. He's oriented ×3. And checking judgment real quick. If this house was on fire, what would you do?
Around that one, worse.
Sounds good. Me too. All right, so the patient has intact judgment as well. So next, I'm going to do a quick set of vital signs for him. So we can check the temperature here real quick. Make sure that thing's recording. Looks like it is. And check your temperature here. Yeah, okay. All right, 97.2. You were no fever, is normal thermic. Wonderful. Look at the respiratory rate. He seems to be in no distress at all. Kind of gauging here a respiratory rate of probably 12 to 14 is what we're looking at. On the sheet it said that do a palpable blood pressure was acceptable. So if we can feel, we have a strong radial pulse 2+, which would indicate that his systolic is at least 90, which is compatible with life. That's great. So we have temperature, respiratory rate. Oh, we just need to check the pulse real quick. So we'll count your pulse for 15 seconds, times that by 4. So pulse rate of 80 right now. So we've got pulse, respiratory rate, blood pressure, temperature, and everything seems to be within normal there. Next up, we would go ahead and we're going to go through the head to toe assessment here. So first of all, I would just look at the head and the face. I would kind of inspect and palpate to see, is there, as far as is the head normocephalic? It is. It seems to be a normal shape. There are no deformities. The face is also normal. Features are symmetrical. There is no deformity there, no abnormal issues that I can see of any kind. From there, we will palpate the head. So we're just going to look here. Any tenderness anywhere?
No.
No? Okay. So I don't feel any bulges. I don't feel any issues with his skull of any kind. There's no tenderness. So we would again call this normocephalic here. And the hair distribution is even as well. Moving on, we would start with the eyes, looking at the external eyes. So looking at the eyelashes and the eyelids, they both appear to be normal and open and upright. Facing lashes are up. We have, looking at the sclera, seems to be white. There's not really any injection or icterus of any kind. I'm just going to look under your eyelids real quick, okay? So looking at the conjunctiva is also healthy and pink, no indication of anemia of any kind. We also don't have any excessive tearing. We don't have any discharge. So the external eye appears within normal. Next, kind of look at the internal eyes a little bit. So we're going to look at the pupils and check the red reflex here. So, sure, if you don't mind, just for a sec. So right here, we're going to go right eye to right eye and check the red reflex. So we're just going to come over here. That is intact on his right eye, and go left eye to left eye here, looking for the red reflex, and that is also intact. So bilaterally intact though. I'm going to check his pupillary response to direct and consensual situations. So first, a little light here in your eye. All right, brisk pupillary response bilaterally. And then I'm going to check the alternate eye here. So by direct and consensual light, both pupils are briskly responsive. They're approximately 3 millimeters and round as well. And we're going to do accommodation real quick. So if I could, I'm going to have you need something with a little bit of distance. So if you can maybe look back in the hallway. So I'm going to have you kind of look at this and then look back in the hallway. Okay. And accommodation seems to be intact as well for pupillary response. Next up, we're going to do a quick eye test, and you can wear your glasses for this. This is the Rosenbaum eye test. We're going to hold this about 12 to 14 inches away from the face. So if you could hold this for me, and we're going to check one eye at a time, and then we'll check both. So roughly speaking, that is about where we want to be. Okay. So first off, I will see if we can, are you able to cover one eye and just read me the lowest line that you can? And you got to keep it about that distance.
Okay. 3, 7, 4, 2, 5, 6.
Okay, and so that is 20, 30 on your right eye. Maybe we could try the other eye.
Three, 7, 4, 2, 5, 6.
Okay, is that the same line?
Yes.
Okay, so we're 20, 30 on both eyes. And if you could try them together.
3, 7, 4, 2, 5, 6. Same.
Okay, so we have each eye is 20, 30, and then also together bilaterally he has 20, 30 vision with corrective lenses. All right. So we've done the eyes. Next, we're going to inspect the nose here. So I first look at the nose and say the nares seem to be symmetrical. There's no deformity with the nose. There's no discoloration. I'm going to have you do what we call a sniff test, which if you can just do each nostril. Okay. All right. Seems to be fairly patent. Maybe a little congestion on the left, but both are patent. And inspection, there's no exudates, nothing coming out of the nose, anything like that. So at this point, we're just gonna look inside your nose real quick, Justin. Okay. All right, so we're gonna check out one nostril here, and okay, so the mucosa is moist, the turbinates are pink and healthy and intact. Not much exudate there at all. Septum appears to be non-deviated from what I can tell you. A little bit of mucus. No other exudate besides that. Check the other nostril. And again, on this side, the nasal passage is patent. Turbinates are pink and moist. And the septum is intact. And again, a little bit of green exudate there. Septum is also intact. It's all there. Very good. Next, we're going to move on to the mouth. So we would inspect the mouth. and see that is there any lesions, any cracks, anything of any kind. I do not see anything like that. The lips are moist, pink, healthy looking. And we're going to look inside the mouth if we could. And so, real quick, Justin, I'm just going to check everything out in here. So, the mucosa is pink and moist and healthy. The tongue doesn't really show a little fissure in the middle. And the teeth, the dentition seem to be healthy and intact. We've got some dental work here. You say right. Hard and soft palates seem to be intact as well. The uvula is midline. Let me see the gums just real quick. All right, gums are pink and healthy, and I'm gonna have you say "ah" one more time for me. It's hard to visualize the tonsils and the pillars, but they are there, and from what I see, they are not inflamed, no exudates, sign of infection or anything like that. So we did gums, teeth, hard palate, soft palate, tonsils, pillars, the tongue. All of those are within normal limits here. Very good. So next, we're going to inspect the ears real quick. So inspect and palpate each ear. No deformity noted here. The skin color is normal for race. I'm just going to feel, okay, let me know if anything is tender at all. Okay, including the mastoid area. Any tenderness?
No.
No. All right, let me try that here. Any tenderness here?
No.
Again, no deformity on either side. The pinna, the tragus, the mastoid area, all of that are within normal limits, and there's no tenderness. We've looked at the external ear. Now we're going to check out the internal ear canal. All right. So, according to the rubric, very important to show you that I'm using the pen light like this, and I'm going to pull the ear up and back to look in the ear canal, kind of pointing the light towards the nose. So I'm just going to grab your ear and then pull it back, okay? And just look inside here. Okay. And the ear canal, should find the right angle here. There we go. The ear canal is completely open, patent, non-inflamed, and I can see the tympanic membrane. It is pink, excuse me, not pink, it is pearly gray, non-bulging, and the cone of light is intact. A little bit of cerumen, nothing else concerning of any kind of infection, exudate, foreign bodies, something like that. Let me show this other ear out real quick. Switching hands here. Just do the same thing. I'm going to pull your ear back, okay? And find my proper angle here. Your ear canal is okay, same thing here. So the ear canal is open, patent. There are no foreign bodies, no exudate, really no cerumen here. I can visualize the tympanic membrane. And again, it is pearly gray, non-bulging, and the cone of light is intact. Thank you so much. Next up, so we've looked at the ears. We've done basically the entire head, eyes, nose, mouth, face, ears. I'll do the whisper test real quick. So Justin, basically I'm gonna whisper into your ear. I'm gonna have you hold one ear closed. I'm gonna whisper. Just tell me what you hear, okay?
99.
Orange.
Orange.
Okay, let's try this one.
Apple. Pillow.
Okay, very good. Whisper test is in order. So your hearing seems to be intact. We're going to move on to the neck. So we're going to inspect and palpate the features of the neck. So first, looking at the skin, he has a bit of a beard. Looks like he's shaven here. There is no sign of rashes, lesions, macules, papules, nothing like that on the face or the neck. Coloration is normal for race. I don't see any pulsations of any kind. Looking at his trachea, I'm going to palpate and just feel at his midline. So I'm just going to feel this here, okay? So patient's trachea is midline. It is not deviated. While I'm here, I'm going to feel your thyroid, okay? So just feeling this gland that sits right here. Feeling for any nodules. By inspection, there is no goiter, not enlarged, and I don't feel any nodules or masses or anything like that on the thyroid gland. I'm happy to just look at the ceiling if you can. And again, okay. And the other part to look at the thyroid gland, which I'll do, is basically just going to have you take a drink of water, and I'm going to be behind you and just feel you swallow. Okay. One second. All right, go ahead and swallow when you're ready. Okay. So the thyroid gland feels of normal size. It is not enlarged, and when he swallows, I don't feel any nodules, masses, or anything like that on the thyroid area. And trachea is midline. Real quick, we're just going to check out the vasculature of the neck, and that is going to be the carotids. We'll check those one at a time, palpating, and we'll listen. So I'm just going to feel your pulse on the neck here, okay? So we have a very strong right carotid here. I don't feel any thrills. 2+. Let me try this side. Same here. 2+ carotid bilaterally. Let's take a quick listen, and then we'll move on to the left sides. I'm going to listen with the bell for any signs of bruit. I can just breathe normal, okay? There are no bruits on the carotid arteries bilaterally. So next we're going to look at the lymph nodes here, and I'm just going to kind of call them out as I feel for them. There's quite a few of them, so we're going to start with the front of the ear. So we have preauricular, we have postauricular, we have occipital, we have tonsillar, submandibular, submental, superficial cervical, and then a little deeper cervical. Can you turn your one side? Thank you. That's a deep cervical there. And over here, deep cervical. Okay. We have posterior cervical. Okay. We have supraclavicular and infraclavicular. And again, throughout all of those, I don't feel any enlarged lymph nodes anymore. Any tenderness, any pain at all with any of that? Okay. Very good. Next up, we are going to move on to inspect the thorax, and I will kind of start with the posterior side, and then we'll work to the front. So on inspection, real quick with the general thorax, the anterior, posterior kind of viewpoint is within normal, 1 to 2. No barrel chest, anything abnormal there that I can see. I'm going to have you lean forward if you don't mind. I'm just going to look at it back a little bit. So with the posterior back here, if he didn't have his shirt on, I would inspect the skin for any rashes, any discoloration, any abnormality, temperature, dryness, macules, papules, concerning moles of any kind here. But right now we're not going to take the shirt off, but anyways, we'll do a skin assessment like that. I would also be looking for general work of breathing and you can see. Work of breathing is non-distress. He has the occasional clearing of the throat, nothing else. And then I'm going to have you take a big deep breath, okay? Okay, now, one more time. Good. Okay. So we have, that's great. Symmetrical movement of the rib cage with deep inspiration on either side. So kind of looked at the respiratory effort, the symmetrical nature of the breathing. Feeling for any fremitus. Take a big breath. Thank you. I don't feel any fremitus at all. And we would also kind of look at the spine at this point, evaluate that for any step-offs, anything abnormal here. I don't feel or see anything abnormal with his spine. And we would look at the paravertebral muscles as well. They seem to be appropriately innervated, strong, symmetrical, bilateral, all the way up. So we've inspected the back. We're now going to, and we palpated it as well. Now we're going to percuss. We're going to do 10 areas on the back, starting with the apex going to the bases here. So just going to kind of tap on you and listen, okay? It's 4, 5, 6, 7, 8. I don't perceive anything of concern at all. There's no hyperresonance, no overt worrisome tympany, anything like that. He also has no crepitus of any kind here. So we have now percussed the 10 areas of the posterior back, looking at the lung fields, and we're going to listen to those 10 areas now. And what I'll have you do, Justin, is just like take a deep breath in and out, and we'll just kind of go through these 10 spots. You're gonna listen to the diaphragm. Take a deep breath for me. Your mouth, good. All right, so in evaluating lung fields, he has good air entry throughout all the left and the right, top to bottom. He has no adventitious sounds, no wheezing, no rails, no rhonchi. Yeah, so he sounds clear. Very good. So now we're going to move to the, well, I'm gonna check for CVA tenderness. So I'm just gonna tap on your sides here, okay, real quick. Just see if you have any tenderness. Anything hurt? No? Okay, wonderful. No CVA tenderness. Moving to the front here, we're going to go ahead and check on the, we'll do the arms first, do the lymph nodes, and then we'll do the upper extremities, and then we'll move to the anterior thorax. So looking at the upper extremities, we kind of inspect those and palpate and look at the skin. Again, is there any lesions, rashes, any concerns? I don't see anything like that here. Distribution is even. Skin color is normal for race. Temperature is warm. He is also dry. Has good muscle mass. No spasticity or anything abnormal noted here. I'm going to just feel your pulses here, bilaterally in your radials. We have 2+ bilaterally radial, and feel your brachial as well. Okay, we have 2+ brachial pulses as well. I'm going to squeeze my fingers. Wonderful. All right. And then we're just gonna look at the hands real quick. We will check the capillary refill. It is certainly brisk, less than 3 seconds here. And the nail angle is not abnormal, no clubbing, nothing of any kind there. We'll look for just briefly the other lymph nodes. So we did infraclavicular, supraclavicular, infraclavicular, lateral. And look, feeling your armpits. These are your deep ones. Okay, there's nothing concerning there. We're gonna feel the pectoral area. Nothing there. We're gonna feel here as well. Posterior cervical, and then we're gonna feel subscapular as well. I don't feel any enlarged lymph nodes anywhere there. So we've done upper extremities, we've done lymph nodes. We're going to do the respiratory part of the anterior thorax. So again, looking, just kind of inspecting his respiratory effort and rate. His rate seems to be non-labored, I would guess around 12 to 14 times a minute. He has no retractions, he's not in any distress. He, the regular rhythm as well, and no bulges of any kind that I can see. I also did not feel any subcutaneous air or anything like that. So we've kind of inspected and palpated here. Percussing is okay to just do on the back. It's not on the sheet, so I'm not going to percuss his front. And then we're just going to auscultate 8 areas on the front of his lungs here. I'm going to get a deep breath again through your mouth. Thank you. All lung fields are clear. There are no adventitious sounds there. So we've kind of done the pulmonary assessment part here. Next, I would move on to looking at the precordium area. And so again, if he didn't have a shirt on, the skin inspection would be there, looking for rashes, lesions, anything abnormal, feeling the temperature, is the skin warm, dry, all that kind of stuff. I would be looking for bulges, retractions, heaves, anything along those lines, the precordia area. Feel, as we palpate, do I feel a thrill anywhere? I do not. And then at that point, we will go ahead and auscultate with both the diaphragm and the bell of all his major heart points, being his aortic, pulmonic, Erb's point, mitral valve, tricuspid valve, and then mitral valve here. After that, we'll do the PMI. So first, I will listen to his aortic valve, which is second intercostal right sternal border. And listen to pulmonic, second intercostal left sternal. Erb's point. Now we're going to listen to the tricuspid valve. And the mitral valve. Now we're going to do the same thing with the bell. Okay. So here's a regular rate and rhythm. He has a solid S1, S2 that I can hear. I do not hear any S3 or S4, so there are no murmurs either. So I don't hear any extra heart tones, just a S1, S2. No friction, no rubs, nothing, no friction, nothing like that. Um, so we'll do the PMI when he lays down for the abdominal part here. But I believe I have to listen. We need to listen to sorry, the bottom part of your heart for a whole minute here, real quick. I'm just gonna come over to your side. Okay. So again, nothing new noted there. Pulse rate of about 84. So we've inspected and kind of done the heart piece here, the cardiovascular piece. So next, we've done the extremities, we've done the lymph nodes, we've done pulmonary, coronary. So next, we're going to go ahead and do the abdominal piece, which will require you, my friend, just to lay on your back if you don't mind, just for a couple minutes here. I'm going to move the tools. If you want, it's usually comfortable to put your feet like that. Wonderful. You okay there for a minute? Yeah. Let me just finish up the cardiovascular piece. We got to feel for the PMI. So basically, the best way to feel for the maximum point of impulse for your heart is to lay on your left side. And so if you don't mind just rolling on your left a little bit, literally just going to feel here, feeling your heartbeat. And it should be about mid-clavicular line, fifth intercostal space, which it is. And it's tapping, feeling about 2 to 3 centimeters. I don't feel any heaves. No concern there. So thank you very much. All right, we'll do the abdominal piece real quick, and then you can sit back over now. So basically, if it's okay, I'm just gonna raise your shirt to just right here, and we're gonna look at your belly, all right? All right. So first, the sequence of the belly is a little different. We're going to inspect, then we're going to auscultate, then we'll percuss, then we'll palpate. And so by inspection, we're looking at, again, the skin seems to be within normal for race. There is no sign of rashes, lesions, petechiae, bruising, discoloration, anything like that. The contour is even, slightly rounded shape, and the hair distribution is even. Umbilicus is in. So kind of assess that. I don't see any bulging. I don't see any movements, peristaltic activity, no masses. This is an easy way to check for a hernia. Justin, are you able to just lift your head up? There you go, good. I don't see anything bulging here either. Okay, so no signs of a ventral hernia. So we've inspected it. Next, we're going to auscultate all 4 quadrants, just checking for vowel sounds. Okay. So he has normal active bowel sounds in all four quadrants. While I have the stethoscope, I'm going to go ahead and just listen to his major vasculature arteries in his abdomen area. Okay. So first, I'll kind of see if I can feel a abdominal pulsation of any kind. I really can't. Next, with the bell, I'm going to go ahead and listen to his aorta, his renal arteries, his iliac arteries, and then I will feel pulses on the femoral arteries real quick. Aorta, renal arteries, iliac arteries, okay, so I don't hear any bruise of any kind of any of this major vessels there. I'm literally just gonna feel right here. Okay, you got a pulse here. Okay. All right. So we have 2+ pulses, femoral pulses there. So we've inspected, we've auscultated. We're now going to percuss real quick in all four quadrants. A little more. Tympanic. Yeah. So by percussing, a little bit more tympanic down low, a little bit duller up top, but overall percussion is within normal limits for the belly. Next, we're going to palpate. So we're going to first palpate light and then deep. Light is just for any tenderness here. So just tell me if anything hurts or anything feels weird, okay? Any pain, tenderness? And if I let go, does it hurt at all? Nothing? So no rebound tenderness either. So light palpation, normal, rebound tenderness, negative. We're going to palpate deeply for any masses or anything real quick. Sorry, it's a little pressure. I do not feel any masses of any kind, deep palpation there. Believe that is it. Thanks, Justin. So the abdominal portion should be complete. We've done our femoral assessment along with the great vessels here. We've already done CVA tenderness. Oh, I wanted to check and see, can I feel the liver at all below the right rib cage border here? Sorry, man, a little deep touch. Maybe a little bit toward the midline, but there's nothing that indicates an enlarged liver. Okay. Any tenderness there? Okay, good deal. Thanks, man. You can set up there. So next we're almost done with the head. So thank you for your patience. That's a lot. So next, just kind of moving down the waist, we're not going to do the, and I forgot to do the breasts. So we're going to do breasts and genitals. So let's first talk about if it was a female patient, we would want to talk about breast self-examination, and I'll kind of talk through actually doing one and then teach on how to do it. So we're going to see, do they do breast self-examinations at home? Do they know when to do it? Which would be after the period, once a month, in the shower and laying down. And you want to do it in front of a mirror too. So if I were to evaluate a female patient by inspecting the breast, first you want to look at the shape, the contour, the symmetry, and then after that, you kind of have them move their arms in a certain pattern here to inspect. So first you would have the patient stand up. Obviously the shirt would be off, the arms are down, and you would inspect the breast there. And then you have them put their arms to their side, sometimes leaning forward, and then inspect from that angle, and then have them raise their arms as well, inspect. And you're just looking for any dimpling, any deformities, anything that indicates a variation in the contour or shape of the breast. Um, and then from there, making sure they understand the importance of doing that monthly to perform the breast self-exam. We have the patient lay on their back. You put a pillow under their scapula and have their arm behind their head. And then you would go through and with 3 fingers, typically, you can either do a circular motion or an up and down. And you want to palpate all the quadrants of the breast, including the nipple, looking for any discharge, looking for any retractions, anything, and the tail of Spence. We look at all that bilaterally. So that would be the portion of the breast self-examination. Now for men, we would want to talk through the penis and the testicular self-examination. So first, from a clinical perspective, to do the genital exam, you would do the same thing: inspect and palpate both the penis, the scrotum, and the testicles. We're looking at the skin, see if there's any lesions, hair distribution, is it even, is there anything, discoloration, swelling, rashes, anything odd there. We look at the meatus to see the location of the meatus, and also is there any exudate or discharge of any kind. And from there, you would palpate the penis and the glands, noting for any tenderness, any warmth, redness, anything odd there. And then you would palpate the testes one at a time as well, looking for any masses. Oftentimes they are not painful either, so, but you'd be looking for any discomfort. And you would also want to do the vas deferens, the epididymis, as well when you're palpating, looking for any discomfort, any masses, any strange situations going on there. And then you want to educate the patient to the importance of asking that they do monthly self-testicular exams and to show them how to do it. So generally you want to do it after you get out of the shower once a month. All the heat tends to relax everything. And then you want to palpate each testy one at a time, going kind of full circumferentially, feeling for anything abnormal, whether it be pain, whether it be mass, anything like that on either testicle, and just keeping an eye on it. So there's that. And then the next part would be, we're going to just do the lower extremities. So again, we are going to look at the lower extremities, inspect and palpate. So looking here, no rashes, no signs of PVD, PAD, particularly the hair distribution is even, the skin color is normal for race. And I don't visually see any signs of any edema. We have good muscle tone, both upper extremities and lower extremities. And then I'm going to feel as well. And we have good warmth here all the way down both extremities. And then here I feel the pulses bilaterally for the dorsalis pedis. We have 2+ there, and we have 2+ on the posterior tibial pulses as well. Again, pushing against the shin bones, there is no sign of any swelling of any kind. There's no varicosities either, so legs seem to be in pretty good shape. We're going to look at the nail angles and the capillary fill of the toes as well. And again, we have less than 3 seconds, good perfusion on the extremities here. And that is the head to toe portion. So thank you, Justin. That's a lot to go through. We got to do 3 other quick tests. One is going to be the cranial nerves, which there's 12 of them. And then we'll do like a musculoskeletal exam, and we'll do a sensory and cerebellar exam. So if you don't mind, we can go back here. That'll be a little easier visually, and hopefully the audio is still picking up. 44 minutes. Whew, gotta go. All right. Cranial nerves, real quick. Going through here, tools. Okay, so the first cranial nerve is olfactory. So I'm gonna have you close your eyes and then hold one nostril for me and see, and tell me if you can tell me what this smell is.
Like alcohol.
Mm-hmm. Good. All right. How about the other side? What does that smell like?
Alcohol.
Good. Very good. So olfactory is intact. Next, we're going to do optic nerve, which basically is confrontation. And so I'm going to have you look at my nose And then I'm gonna wiggle fingers and just tell me where you see them in your visual field. All right. All right. So here we go.
Right,
Okay.
left, right, left, left, right, and left.
Very good. Okay. And so confrontation is done there. We're also going to do the have you do like a far lateral gaze. If you can look all the way over towards my hand over here, see if I see any nystagmus, no nystagmus. Okay, very good. And then I'm gonna have you do what's called a cover uncover test. So I'm gonna cover one eye and just look at the other eye. I can do this. Thanks. All right. And then looking at this eye. Okay, now I'm gonna do an uncover. And I'm gonna do an uncover. Okay, I don't see any strabismus, nystagmus, anything like that. Next up, we are going to do the 3, 4, and 6. So that's ocular motor, that is trochlear and abducent. So that's basically looking at the cardinal fields of vision. So if you can just follow my fingers, okay? Go one side, other side, up, down, and good. Okay. Okay, very good. So those are all intact. Don't see anything abnormal with the movement there. We need to do the trigeminal. So I'm gonna close your eyes real quick. I'm just gonna touch you and tell me where am I touching you, okay?
Right forehead,
Okay.
right cheek,
All right.
right chin,
Okay.
left forehead, left cheek,
Yeah.
left chin.
Okay. All right. So I'm gonna touch you sharp and dull and just tell me which one it is, okay? It's a little pin, so don't forget, I'm not gonna stab you. All right, ready? Close your eyes. Sharp or dull? Okay, what is that?
Dull,
Stab.
sharp,
Stab.
dull,
Okay.
sharp, dull,
Okay.
sharp.
Okay. Very good. All right, and then I'm just gonna have you let's see here, squeeze your chin, close your jaw hard. I'm just gonna feel your muscles here. Okay, so squeeze hard. Okay, here and here. And I did not check your sinuses earlier, so I'm just gonna check your sinuses and just see if you have any tenderness here. Okay, any tenderness?
No.
Okay. Next up, we are going to do 7 facial. So I don't see any exaggerated facial movements of any kind. Can you smile for me? Okay, very good. 8 is auditory, and my friend Justin here has some tinnitus, so I think it's better and safer so he doesn't have ringing in his ears all day long that I'm just gonna walk through this and not actually do it to him. We would do the Weber's test with the tuning fork, and we would put this right midline and see if he hears it on both sides and is there any lateralization. And then we would do it on each side here behind the mastoid process. We would wait for it to stop ringing where he can't hear it through the bone. Then I would put it through his to his ear this way and see if he can still hear it. And I would do that on both ears. And ideally, he would be able to hear it much longer through the air than through the bone. And we would time that as well to make sure it's equal on both sides. And a lack of lateralization on the Weber is normal. And a air conduction greater than bone conduction on the hearing with the Rennie's test is normal. We would time that for both ears. But because of the tinnitus, we're not going to do that. So that's auditory, which is 8. 9 and 10, real quick, we're going to look at your mouth here real quick. So I can have you, where's that water? There we go. I have you take a drink of water here. Okay, very good. And just open up for me and say, ah. Uvula is midline, it raises appropriately. He was able to take a drink of water. Just have to check your gag reflex. Okay, sorry, man. Say, ah. Okay. Gag reflex is intact, so that's 9 and 10. 11 is accessory muscle. Can you push up on me here? Good. Strength 5 out of 5. Can you push against me here? Good. Hard, hard, hard. And then here. Okay, very good. All right, so strength 5 out of 5 there. And the final one is hypoglossal. So that was glossopharyngeal and vagus, by the way, and then accessory spinal. And now we are going to do the hypoglossal, which is just basically having you move your tongue. Can you stick out your tongue? Go left, right, up, down. All right, and then push against this a little bit. Okay. All right, good. We are intact there, nothing abnormal. The other 12 cranial nerves. We're gonna move on to musculoskeletal. We're gonna do this quick and under 9 minutes. 2 of them to go. Okay, real quick. So musculoskeletal. Do you mind? I'm just gonna kind of look at him from afar. It's gonna be shoulders and iliac crest. Are they symmetrical? There's no deformity, and the alignment is good. And then I'm going to look at the curvature of the spine, if you don't mind standing up for just a sec. Curvature of the spine is normal, no excessive curvature of any kind here from cervical, thoracic, or lumbar. Can you touch your toes a little bit? All right, good. And then I don't see any scoliosis here either. Okay, good. You check your range of motion in your spine. So if you can, kind of just twist one way and then the other. All right. And can you bend forward and backwards a little bit? There you go, good. And arms way up. All right, good. And then sideways if you can. Okay, range of motion is intact there. Next up, we are going to look at the, let's see here, the upper extremities here. So we're going to inspect and palpate all the extremities, the fingers, the hands, noting any crepitus, tenderness, warmth, all the way up to the elbow joint, to the shoulder joint. Anything like that? Any problems here? No crepitus, any tenderness? Nope, nope. Elbow joint here, shoulder joint, any tenderness here? Okay. And so then we'll do range of motion. So if you can open and close your hands, very good. And then we will do, can you move your wrists up and down, sideways? All right, and do circles. Okay, very good. And then we're going to do elbows, just full extension and flexion. Very good. And then we're going to do shoulders, which is going to be arms out at your side like so, down, up, and back. Good. Can you touch your hands? I don't know if you can. Okay. And then we're just going to go side and see if you can cross that midline on either side of your shoulder there. Okay. So overall, range of motion looks good for the shoulders. We're going to do strength real quick. So can you squeeze my hands? Good. 5 out of 5 there. Now have you open your fingers and don't let me push them closed. Okay. Good. Good strength here as well. All right. And then now I'm gonna have you we're gonna do push pull. So just push against me or pull, whatever you want to do first. Good. And then pull back. Okay. Very good. 5 out of 5 strength there on the upper extremities. Lower extremities, we're going to do. All right. So if you could mind sitting for just a sec. We're going to palpate for any crepitus, tenderness, warmth, anything along the toes, the ankles, the knees, or the hips. Anything there? Nope. All good? All right. Range of motion. If you can move your feet up and down and sideways, we're checking that can you curl your toes? Very good. And then can you do this eversion and inversion of your ankles a little bit? Okay, that is intact. Are you able to raise your knees one at a time like this? Extend and back. Good. Very good. So range of motion there is good. And then basically here we're going to check your range of motion of your hip, which is going to be, see, can you raise up for me here, like so, and down, and can you come out? Good, and then come across. Good, and go up. Okay, down, out, across, yeah, and back as well, please. Yeah. All right. So range of motion seems to be intact. We also have good muscle tone in upper and lower extremities. There's no flaccidity, no spasticity, nothing like that. I'm gonna check your strength here real quick. So if you don't mind, sit down. We're almost done here. Okay, just push pull Push here. Okay, pull your toes back. Good, and try and push it out against me. Good, and then push that knee up, and that knee up. Okay, 5 out of 5 strength everywhere on the lower extremities here. Believe that is it. So moving on, we have 5 minutes to do the final one lesson. All right. So if you could stand up for me real quick and just walk back and forth. All right. Gait is steady. Posture is good. No issues there. Wonderful. All right. So now I'm going to have you raise one foot. Good. Raise the other foot. Wonderful. And then if you can do a little heel toe. And then you go backwards. Good. All right. No ataxia. Cerebellar is good. Can you do quick fingers here? All right. And then can you do finger to nose? Very good. And can you do the shin? Just scratch your shin there. And the other way. All right. Excellent. So then we're going to check sensation. So if you can sit down here real quick. We're going to do soft, sharp dull. Okay, so close your eyes real quick. And tell me, where am I touching?
Right arm.
Okay, how about now?
Right chest.
Okay. And is this sharp or is this dull? All right.
Sharp.
Okay. What about here?
Dull.
Okay. Where am I touching you right now?
Left wrist.
All right. What about now?
Left arm.
Okay. Sharp or dull?
Sharp.
Okay. What about now?
Dull.
Okay. Very good. Now I'm gonna check your vibratory sense here real quick. All right. Do you feel that?
Yes.
Tell me when it stops.
No.
Okay.
Yes.
Yep. Tell me when it stops.
No.
Okay. Good. All right. Now I'm gonna check sensation on the lower extremities. So tell me when am I touching you?
Right leg.
Sorry, I close your eyes still.
Oh.
Okay. Yep.
Right hamstring.
Okay. What about now?
Left.
Upper or lower leg?
Lower leg.
Okay. Upper or lower leg?
Upper leg.
Okay. What about now?
Lower leg.
Okay. Is this sharp or dull?
Sharp.
Okay. Okay.
Sharp.
Okay. Where am I touching you?
Left leg. Lower.
Okay. And then is it sharp or dull?
Dull.
Okay. Very good. Vibratory sense here real quick, and then we'll do your deep tendons. All right. Do you feel that?
Yes.
When does it stop?
No.
Okay. Do you feel that?
Yes.
When does it stop?
No.
Okay. Very good. Finally, we're going to do deep tendon reflexes. So brachioradialis, biceps, triceps, and just looking for a little twitch here. Okay, so here we go. Very good. All right, a little bit on the biceps here. Very good. Okay. Okay. And I'm gonna do your triceps. Sorry, I'm sorry, I'm doing this so fast. We got 2 minutes. So just let your arm hang. Okay. Okay. One here. All right. Very good. Patellar. Yeah, you're almost hyper-reflexive. All right. And then Achilles, you have to hold your toes up just a little bit and do just a quick Achilles. Okay. And I'll hold your foot and let it be calm. Okay, very good. Babinski, checking on that. The toes curl, which is ticklish, is negative, so that's normal. I got 1 minute, so let me make sure. What am I missing here? Stereognosia and graphesthesia. So, and I'm just using my cheat sheets here real quick. So I'm going to put something in your hand. Close your eyes for me. And tell me what it is, okay? What is that thing right there? So, wonderful. Okay. And now, I'm going to draw something in your hand. Basically, it's going to be a number. Tell me what number this is, okay?
7.
Okay.
6.
Okay. I'm going to do it. Okay, what about this one?
0.
Okay, very good. We have like 20 seconds. I feel like that is about it. We had to rush to the end. Time management wasn't the absolute best, but I believe that's what we got. So thank you for your time. Hopefully the rush at the end doesn't interfere too much, but I think we got it done. Thank you.